I'm Troy Kirby with the Journal of Olympia, Lacey, and Tumwater with a quick look at the 2021 Washington State Legislative Session. House lawmakers debated Second Substitute Senate Bill 5313, establishing that health carriers may not deny coverage for medically necessary gender-affirming treatment. The bill passed the Senate on February 26 by a vote of 30-17 and passed the House 57-41. Both the House and the Senate will now negotiate on amendments to the bill, and if passed, the legislation will make its way to the governor's office for the opportunity to be signed into law.
We know that gender-affirming care can be life-saving for people who are transgender or gender nonconforming. 40% of people who identify as transgender attempt suicide in their lives. And we know that Black trans women in particular face especially high rates of violence. Last year, I brought a bill to this body that was signed into law to end gender-based discrimination that has prevented our transgender neighbors from getting the care that they need. This bill would close a loophole that has allowed insurance providers to deny coverage for services they typically would consider cosmetic.
We've heard in this discussion a question of dignity. And I think dignity is an important concept to think about in this issue. Does gender affirming procedure install dignity into a person? I believe it doesn't, Mr. Speaker. I believe dignity is something that is deeper than that. I believe dignity comes out of an individual. It emanates from an individual. And if dignity is the issue here, and I think it's a good word, and I think it is the issue, we should focus our public policy on helping people find their dignity and develop their dignity. But Mr. Speaker, that is not a direct tie to medical procedures.
When we heard testimony on this bill in committee, one of the things that really struck me was the disproportionately high suicide rate amongst our transgender neighbors. And we know that with access to medically necessary gender-affirming treatment, their suicide rate becomes the same as the general population. We know that transgender people in Washington State struggle with health equity and face disparities that limit their access to care. This bill ensures health equity for our transgender neighbors and ends the unfair discrimination and denial of care that can and will save lives.
I don't know if you're aware of this or not, but over COVID, maternal suicidality has gone up 3 times, and it's mostly for our most vulnerable populations. And you know, part of this bill is saying we are not going to discriminate over gender. You know, I've had many friends and also many foster children who identify as trans, and I know some of the deep depression and issues that they've had to face over the changes with their body and where they are at mentally, and having people accept them. And so,
thank you for watching the Daily Legislative Report by the Journal of Olympia, Lacey, and Tumwater, covering the 2021 legislative session.